Hi everyone, we are running around maybe around just 2 minutes late. Some last minute tech issues. We'll start as soon as we get. Okay, hello and good evening everyone. I welcome you all to You Matter by Covidav. It's our knowledge sharing initiative. Those of you who have joined in across our platform, so just to let you know that we are right now live on AirMeet. We are also streaming live on Facebook and YouTube as well. Uh, those of you who want to catch the stream on Facebook may go to our Facebook page. That's Care Covidav. And those of you who want to check our YouTube stream, you can do the same as well. It's the same process. So those of you who have joined in and do not know about Covidav, I would just like to spend some time over here. We are an online mental health platform. We started somewhere in April 2020 with a vision to democratize access to high quality mental health care. Uh, while we have partnered with psychiatrists and psychologists from leading mental health organizations like the Directorate of Health Services, Government of Goa, Psychiatric Society of Goa, leading NGOs like Sangat, Kuj Mental Health Foundation, and Antarman. Uh, our part to democratizing mental health care goes through a lot of initiatives around spreading knowledge about mental health and also creating awareness about the different issues which are relevant in the current context. And with that in mind, we launched You Matter by Covidav, a knowledge initiative, where we invite eminent mental health experts who share their knowledge and best practices around maintaining a great, healthy mental health lifestyle, as well as some best practices around maintaining a great emotional well being. And with that in mind, we would like to invite, rather welcome, our first guest for today's session, and that's Dr. Rashmi Navelkar, who is a Mumbai-based psychiatrist and has herself been associated with Covidav since our launch. Welcome, Rashmi.
Yeah. Hi, Nishadh. Hi. Hi, everyone.
Rashmi, yeah, I can see you now. So, today's what we're going to speak about today is around fighting anxiety and building resilience. I'm sure all of you would have been anxious at some point in time. It's very common to feel a little bit of anxiety here and there, whether it's before an examination or whether it's before a job interview, or even before a big event, say a wedding or something of that sort. Well, it's normal to have a little bit of anxiety here and there. I'm sure there are some problems which can, crop up as things go south, and that's what we're going to discuss with Dr. Rashmi. Um, those of you who are watching us on AirMeet, you can just post your questions in the chat itself. Those of you who are watching this stream live on Facebook or other channels can post your questions in the live chat, and we'll get to them through the course of this event. All right. So I'll quickly start with our first question today. Well, let's start with the basics. So, what is anxiety, and is it normal to be anxious?
Yes, anxiety is derived from a Latin word anxitas, which basically means to throttle or to choke. So, it is basically our body's cognitive, emotional, and physical response to a perceived danger or a challenging event. Yes, anxiety is very much a normal human experience. It's a anxiety, fear is a normal human emotion. We tend to get anxious before a job interview or a viva, or before we have to meet deadlines, a presentation. It's perfectly normal. Everybody in the situation will feel the same way. Suppose you have witnessed a road traffic accident, and that the rest of the day you'll keep feeling distressed or uncomfortable, not at ease at all, and you might feel restless. That is perfectly normal. That anxiety is perfectly normal. So basically, in moderation, anxiety is, it stimulates a anticipatory or a healthy adaptive response, and prepares us to counter the stressful event. So, but however, when it occurs in too much excess, that is when it destabilizes us. This is what we call as nervous breakdown, and that is when it becomes a dysfunctional or a problematic state.
Okay. Uh, just moving on. Uh, when is anxiety considered to be abnormal, or what is anxiety disorder?
See, anxiety, as I said, it is a normal human experience, but when it occurs in excess, or it is considered abnormal or a disorder when it occurs in the absence of any stressful event. It causes a lot of distress and interferes with our daily life. It occurs out of proportion to the stressful event causing it or triggering it, both in duration as well as in severity. It causes social, occupational, physiological, or even bodily impairment in us, and it increases to so much, to an extent so much so that we start avoiding the social situations. So basically, if because of anxiety you're missing out on your normal or usual life experiences, that is when it is considered as abnormal, or it needs attention.
Right. So, how common are anxiety disorders, and how do I know that someone is at risk of getting one?
Anxiety disorders are very common. In fact, they are the most common of all psychiatric disorders. In India itself, we get almost more than 10 million cases per year. Its overall prevalence is 20.7%, which basically means that 20 out of every 100 people are suffering from some or the other anxiety symptoms or anxiety disorders. There are various types of anxiety disorders like generalized anxiety disorder, panic disorder, PTSD, social anxiety disorders, etc. Now, coming to the second part of your question, who is prone to this? It depends on many factors like genetic factors, environmental factors, and even the psychological states. To name a few things, I would say people who are overtly sensitive to criticism, who have a tendency to overthink, who get worked up pretty much easily over every small trivial thing, they are more prone, or they have a tendency towards developing stress and anxiety disorders.
Okay. What are the symptoms of anxiety disorders, and is there a way that we could ourselves diagnose it? Is there a possibility for self-diagnosis of anxiety disorder?
Yes, you can definitely self-diagnose anxiety disorder, but you cannot self-treat it. For that, you'll have to go to a professional only for help.
Right.
The presentation of anxiety disorders can vary from patient to patient. To name a few symptoms, I can say from head to toe, we can get headaches or dizziness, giddiness, tingling sensations, tremulousness, shivering, worrying all the time, ringing in the ears or decreased hearing, difficulty in breathing, as if there is a lump in their throat, breathlessness, chest discomfort, uh, stomach upset, nausea, vomiting, diarrhea. Some people even present with increased frequency of urination, increased muscle tension, burning sensation in the body, sleep disturbances, irritability, decreased concentration, distractibility. The symptoms can just go on.
Okay. So, what sort of treatment is available for anxiety disorders?
There is a wide variety of treatments that are available. We can categorize them into pharmacological and non-pharmacological. Pharmacological are basically the medications that we give. So the most commonly used are anti-anxiety drugs and antidepressant group of drugs. And in non-pharmacological modalities, we have the therapies and the counseling sessions. So to name a few, there is cognitive behavior therapy, exposure therapy, progressive relaxation, breathing exercises that we teach. And in addition to all this, there are other modalities which are thought to be helpful, but only in addition to this primary modalities that I've previously mentioned. They are yoga, meditation, mindfulness practices, and even vipassana, some say, is quite helpful in dealing with anxiety disorders.
Okay. Uh, Coming to something which is very prevalent right now, and that is stress. I mean, we have seen stress being very prevalent in cases like people who are not used to working from home are now working from home. So, how is stress related to anxiety?
Stress and anxiety are quite interrelated. Stress is basically our body's uh, uh, it's a state of emotional and physical tension. It's our body's reaction or physical reaction to a threat or a challenging event. So when stress occurs, it releases some stress hormones, which are cortisol and adrenaline or adrenaline. This causes certain physical reactions in our body, which are in response. It prepares us to face the danger. So these reactions are basically some things like it increases our blood pressure, it increases our blood sugar levels, increases our heart rate. It can cause indigestion, tearfulness, tremulousness. All these are basically nothing but symptoms of anxiety,
Right.
like I've previously mentioned. So yes, stress and anxiety are directly related.
Okay. Okay. Well, those of you who have joined in a bit late or who have just joined in, I just like to set the context. You Matter by Covidav is our knowledge initiative where we are helping everyone, our users, and everyone around us about the various aspects of mental health and what one can do to ensure there's a ensure a healthy mental health lifestyle as well as path to good emotional well-being. Uh, Moving on to the next question. Given the current situation, I mean, I've been hearing a lot of people say that they have COVID anxiety, for example, wherein they feel that they've been infected by the coronavirus. So, given the current situation that we are in, uh, how do we know that we are at risk of more at risk of developing the anxiety?
Yeah, given the current situation, all our routine has disturbed what we have been practicing for the past so many years. But more so, the people who have a tendency towards developing anxiety, since that's what we are talking about today, are the people who might have had a severe form of COVID infection, especially the elderly age group of people. Then those who have been suffering from some pre-existing medical condition, these are more at risk. Even I can say children and teenagers for that matter, because their whole life is restricted to their home. Everything from schooling to playing, everything is indoors now. That can cause a lot of fear and anxiety and even irritability amongst children. Then other than them, I think the essential services workers and the frontliners, they might be at risk of developing anxiety symptoms. Then people who are living in group settings, say in hostels or in old age homes. So because we've been told not to crowd together, but here people live together in the same room. There are 10, 20, 50 people living. So that, I think that can create a lot of anxiety amongst them. As opposed to even people who are homeless and destitute, they also might be at risk of developing, because they are out in the open and more at risk of directly contracting COVID. And other than that, people who live alone, so out of loneliness and overthinking, they also can be at risk of developing anxiety disorders.
Okay. We've got one question. How do we make sure that anxiety doesn't affect our productivity?
See, if you are anxious at normal levels, like I've previously mentioned, it is not, it's a temporary thing. If it is happening for a long time consistently, then it is something to worry about. And that is when you have to catch it in its early stages. If you think you are getting the symptoms that I've mentioned previously for a long duration, or it has started affecting your routine life, then you must seek help as soon as possible. uh, uh, and increase productivity, I think you should structure your day well. Since we all are working from home, I think that is a very essential thing, because the work and home life boundaries are very obscure now.
Right.
So we need to structure our entire schedule accordingly.
Okay. So another question: how do we manage anxiety in children? As parents, they often tend to get worried about their children, and that's primarily due to, and since it's a complete shift in paradigm for children as well due to online classes and all.
Exactly. So, children have numerous questions to ask, and more so, I think nowadays the situation is that the parents themselves are not much aware of what exactly is happening and what are the risks. So they tend to get anxious themselves, and it completely reflects on their children, because children learn from what they see their adults doing. So I think first and foremost, the adults should know their facts, right? uh, Bring your child or teenager, talk to them, tell them that this is the ongoing situation. For younger children, you cannot really expect them to understand everything, so you can just tell them that there is a disease going on around us, and people are getting really sick. So if you go out and play with other children, you might also get sick, and we don't want you to get sick, so you have to stay at home. Or to manage children and their irritability or mood tantrums, I think you have to devise productive ways of keeping them engaged at home. So, like if you want to teach them discipline, say cleaning, or want them to help you in your daily chores, you can just make it a playful activity. Like you can just ask them to gather their toys and throw them in a basket instead of just gathering everything and then making it look like a like work. So you can also enjoy with them. Make it more interesting for the children.
Okay. Well, so I think we'll move on to our last question before we have more questions from the audience. To those of you who are watching us on Facebook or other channels, request you to kindly post in your questions there, which Dr. Rashmi will answer. Uh, so, how important is it to maintain our mental health during these difficult times? I mean, we keep hearing, that this is COVID-19 has established a new normal for as far as mental health is concerned. So, what can we do to, maintain a positive mental balance around these times?
See, mental health, as you mentioned, is very important. It is a very essential part of our overall health and well-being. It completely affects the way we behave, act, or react to these times of emergency. So, maintaining a good level of mental health is very much essential, especially now in these testing times. So to maintain, I think rather than the rest of us, I think it's more important for the people who are already suffering from some mental health condition like anxiety, depression, or substance use disorders or psychosis. So in these people, it is very essential to be cautious, and they should be regular with their medications. If they develop some new symptoms or they have a worsening of pre-existing symptoms, they have to contact their mental health care provider immediately. And to do this, I think nowadays there are many platforms, social platforms available, since we cannot personally or physically visit a doctor very easily because of COVID restrictions. We can always take the help of certain free and online services, for that matter, like platforms like Covidav, which provide free mental health services across the country. And I think it is really appreciable of you to do that.
Thanks.
And you help people connect with skilled and professional counselors and doctors, and people can seek help from anywhere actually. And other than this, I think to maintain your mental health, especially in this COVID times, to reduce anxiety and stress, you need to know your facts right about COVID and avoid spreading of unnecessary rumors, which can only worsen your stress and anxiety and increase more stigma around this COVID situation.
That's right.
Then you can just you have to maintain a healthy level of mental energy. You should not get worked up about everything that is on your plate. You have to prioritize only the most urgent matters at hand that are pertaining to your health or your family's health. They should be looked into. Then you should know where this treatment of COVID is available, when and how to get treatment, uh, whom to contact, or which is your nearest center that is providing COVID treatment. Other than this, I think you should maintain your overall health, take care of your, get adequate sleep, exercise regularly, eat healthy, and especially in eating habits, I would advise people to avoid excessive use of caffeinated drinks like tea and coffee, because they tend to trigger or increase or worsen anxiety symptoms. Other than this, I think you can just, because there is a lot of time at your disposal, you can just take time to unwind and reconnect with your long lost hobbies like drawing, painting, music, dancing, reading, anything for that matter. Just take some time out for yourself, because all these years we've been looking for a work life balance, and now it's all chaotic. Work and home life is happening in the same place, so it's very difficult to draw a boundary between the two. But and you mentioned about work from home stress, as they call, because there is no fixed structure to our day. So to reduce this kind of work related or work from home stress, I think I would advise people who are working from home to like devise or mark out your territory at home, whichever corner of your house that is only your office space. It should not uh, cross over to your home life space, whether it is a balcony or a part or a corner of your bedroom or your table, but there you have to only do your office work and not your home work. Other than this, I think most of these people who are working in corporate sector, they are also working from home. They use laptops, and now essentially we are more dependent on internet more so to work from home. So
Right.
make sure that you have a good internet connection, because slow internet or that can be really frustrating and really increase our level of anxiety
Right.
and stress. Then regularly take breaks from this work from home also, because we are only sitting at one place and working, we don't pay attention to our bodies. So take regular breaks, do some stretching, just and even if you're loaded with work, don't get stressed, because if there is a lot on your plate and you have to meet some deadline, don't get worked up. See, I know you receive work in the form of emails or invoices. So instead of telling yourself that, oh, you have to finish say 20 invoices by the end of the day, you can tell yourself that you can just finish a report or one invoice in the next 30 minutes. So that way you're breaking your huge task into smaller steps, and after every step you can just take a break, take go for coffee or whatever, just take a break. Then other than this, I think what I would advise people, especially from corporate sector, is that follow this 10-minute rule. You get very lazy to start work, or if there's some big assignment that you need to start, you just procrastinate it at times. So don't do that. Just tell yourself, I will do this for the next 10 minutes, no matter what, and then after that I might take a break. So more often than not, if you sustain for those 10 minutes, you will end up continuing with the work instead of leaving it halfway. So that can be a real push, I think.
Okay. Thank you, Rashmi. I think it was very informative. I'm sure it will be very informative for everyone who's in the audience as well. Uh, I will quickly go to any questions if we have, if at all we have from the audience. Okay, so we have one question. So it's so this person says that they consume alcohol and smoking as well on not very frequently. Uh, will that in a way affect their anxiety? I believe he's trying to ask if alcohol consumption or smoking could affect anxiety in any way.
Yes, yes, definitely. It can worsen your anxiety if you already are suffering from any. Then those who are addicted to alcohol per se, suppose you've been drinking alcohol daily for a certain number of years, and then you don't end up drinking for even a day or two, and if you're addicted to it, if you're suffering from alcohol, you can develop a withdrawal state, if you don't get the amount of alcohol at the regular time. And the withdrawal state or the physical symptoms of withdrawal state are very similar, or they are exactly same as anxiety symptoms that I've mentioned, like tremulousness, excessive sweating, irritability, headaches, body aches, etc. So yes, definitely with alcohol use, your anxiety can worsen.
Okay. Uh, so I think that's about it, and we have also just reached our predicted end of time. That's 30 minutes. Once again, Rashmi, thank you for obliging and spending time on the weekend. educating all of us about anxiety and what we can do about leading to a path to a great mental health well-being. Great to have you, and I'm sure we'll invite you again for some more knowledge sharing in the future.
Thank you so much, Nishad. Thank you for having me here. It was great, this interactive session, and I hope our viewers have benefited at least a bit from it. And let's look forward to more such interactive sessions.
Sure,
Thank
sure.
you.
Sure. Thank you so much. Before we end, I would just like to end it on a note. So, those of you again who are not sure about what Covidav is, it's an online mental health platform that has partnered with leading psychiatrists and psychologists from mental health organizations like the Directorate of Health Services, Government of Goa, Sangat, Antarman, Psychiatric Society of Goa, and Food Mental Health Foundation. To book an online mental health consultation, all you got to do is just visit www.covidav.com. That's covidav.com. Right now, we are offering a free mental health consultation of a 30-minute duration. Right, so that brings us close to the first session of COVID AV. You matter by COVID AV. Till we see you again next time. Thank you, everyone, and have a great weekend.